For millennia, humanity has sought a potent weapon against pain. From the ancient poppy fields of Mesopotamia to the sterile labs of modern medicine, we've chased the elusive promise of relief. But in our quest, we've stumbled upon a cruel paradox, a medicine that mends but also enslaves. This is the story of opioids, a double-edged sword that cuts both ways, leaving behind a trail of both hope and addiction. It's an epidemic that whispers in the shadows, a silent storm that ravages families and communities. It starts with a prescription, a doctor's promise of relief. But soon, the promise fades, replaced by a crushing dependence, a prison built of chemical chain. This is the story of millions trapped in the grip of opioids, fighting a battle they often lose in silence. They call it pain relief, but it steals so much more. It steals your dreams, your relationships, your very sense of self. It's a thief in the night, disguised as a helping hand. This is the story of the human cost of the opioid crisis, a tragedy etched in broken lives and shattered families. We engineered a miracle, a molecule of pure pain relief. But somewhere in the lab, in the pursuit of progress, we birthed a monster. This is the story of how a scientific marvel morphed into a menace, a testament to the unintended consequences of our own ingenuity. It's not just a few fringe cases, it's woven into the fabric of our society. We're a nation hooked on hope, prescribed a false sense of comfort. This is the story of a nation grappling with a collective addiction, a struggle for recovery that demands attention and action. Welcome to Cause Effect Channel, where we explore unseen forces that shape our everyday life. We begin in the mind's eye of a promising athlete, Mark, at the peak of his career. One fateful day, a severe injury sidelines him. Mark was an accomplished sportsman, his name whispered in hushed tones of admiration in locker rooms and spectator stands. With every triumph, every medal, every accolade, Mark's star shone brighter. But then, in a cruel twist of fate, an injury on the field sent him spiraling into a world he'd never known. Picture this: Mark, once the embodiment of vitality, now grappling with debilitating pain. His dreams, once within reach, now obscured by a thick cloud of uncertainty. His world, once filled with cheers and applause, now drowned in silence. And in this silence, Mark found a companion, a little white pill prescribed by his doctor to help him manage his pain. At first it was a blessing. The opioids, like tiny knights in shining armor, battled the pain, giving Mark a semblance of his former life. His days became bearable, the nights less restless. But as the weeks turned into months, a subtle shift occurred. The pills, once his allies, began demanding more of his attention, more of his time. They were no longer just painkillers. They were becoming his lifeline. Mark's reliance on the opioids grew. The line between need and want blurred, then disappeared. The pills, once a means to an end, became the end itself. His life, once defined by his passion for sports, was now defined by his next dose. Mark was descending into the shadowy world of addiction, a world he never intended to explore. His story is not unique. It's a narrative shared by countless others who started their journey with a prescription bottle in their hand and ended up in the throes of addiction. It's a tale that underscores the insidious nature of opioid dependency, how it can creep up on you silently, stealthily, until it's too late. Little did Mark know his pain management solution would soon become his biggest life challenge. Mark's story is not unique. Millions across the globe find themselves entangled in the invisible chains of opioid addiction. Opioid addiction, a chronic disease characterized by the compulsive use of opioids despite harmful consequences, is a global crisis. It's a silent battle, fought in the privacy of homes, away from prying eyes. Interestingly, opioids have roots in ancient times, used as remedies for pain and other ailments. However, the transition from age-old panacea to modern-day peril has been a complex journey. The allure of opioids lies in their power to numb pain, but it is a double-edged sword. Their ability to trigger intense feelings of pleasure makes them highly addictive, leading to a rise in their misuse. Today, opioids are not just a medical issue, but a societal one, affecting millions across the globe from all walks of life. The path to opioid addiction often starts innocently, with a simple prescription for pain relief. But how does a tool for pain relief transform into a life-altering addiction? An intriguing question, isn't it? To understand this, we first need to delve into the workings of the human brain. Imagine your brain as a bustling city with highways of neurons transmitting signals from one area to another. These signals, or messages, are carried by chemicals known as neurotransmitters. Now, in this city of neurons, there are special receptors. Think of them as docks designed to receive these neurotransmitters. One such dock, known as the opioid receptor, is the key player in our story. Under normal circumstances, the body produces its own opioids, endorphins, which dock at these receptors to regulate pain and emotions. But when an opioid medication enters the scene, it mimics these endorphins and docks at the opioid receptors, flooding the brain with a signal of intense pleasure, a euphoria that far surpasses any naturally occurring endorphin high. So, how does this pleasure turn into a dependency? Well, as the brain gets used to this opioid-induced euphoria, it starts to adjust, to recalibrate. It's like turning up the volume on a quiet song until it's blaring. The brain craves that high volume, that intense pleasure, and starts to find the normal, natural endorphin volume too quiet, too dull. And that's when the dependence sets in. The person begins to need the opioid just to feel normal, to reach the volume their brain has now adjusted to. They may start taking more opioids more frequently, chasing that initial high, that loud volume that their brain now sees as normal. And all the while their brain is adjusting, turning the volume up even higher, creating a vicious cycle. This isn't a choice or a lack of willpower. It's the brain's natural response to the presence of opioids, a physiological adaptation that can lead to an insidious, life-altering addiction. The transition from pain relief to dependency is a silent, insidious process, often unnoticed until it's too late. It's a journey that starts with a single step, a single pill, but can quickly spiral into a lifelong struggle. But understanding this process is the first step in combating the opioid crisis. Could Mark's addiction have been prevented? What factors contributed to his opioid dependency? There's no easy answer to these questions, but let's delve into the complex mix of risk factors for opioid addiction. To begin with, the very act of prescribing opioids can trigger a potential path to addiction. These powerful painkillers are typically prescribed for a range of conditions, from minor injuries to post-surgical pain. However, prolonged use or misuse can lead to physical dependence. The body begins to crave the drug, setting the stage for addiction. Prescription practices play a pivotal role in this process. Overprescribing, lack of follow-up, and failure to explore alternative pain management strategies can contribute to the problem. It's not just about the quantity of drugs prescribed, but also the context and supervision. Individual susceptibility is another key factor. Each person's body and brain respond differently to opioids. Some may be more prone to addiction due to genetic predisposition or mental health conditions. Stress, trauma, and social environment can also influence a person's vulnerability to addiction. But what if we could intercept this journey to addiction? The good news is, we can. Prevention strategies are our strongest weapon against the opioid crisis. Education is a potent tool in this battle. By educating patients, healthcare providers, and the public about the risks and alternatives to opioids, we can promote informed decision-making. Prescription monitoring programs can help track opioid prescriptions and detect patterns indicative of misuse. This can alert physicians to potential problems before they escalate. Lastly, implementing safer prescribing practices is essential. This includes prescribing the lowest effective dose, regular follow-ups, and considering non-opioid alternatives for pain management. In essence, prevention is about creating a balance between providing pain relief and mitigating the risk of addiction, a balance between individual healthcare needs and public health concerns. Identifying and addressing risk factors is a crucial step towards preventing opioid addiction. By understanding these risks and implementing prevention strategies, we can help individuals like Mark navigate away from the precipice of opioid addiction. And that, my friends, is a cause worth fighting for. Once trapped in the grips of addiction, is there a way out? Let's venture into the realm of treatment and recovery. It's a journey, no doubt, but one that's filled with promise and potential. It's important to understand that the path to recovery is not a straight line, nor is it the same for everyone. Treatment for opioid addiction is as diverse as the people it affects. There are a variety of methods available, each with their unique benefits. Some may find solace in medication-assisted treatment, where medications like methadone, buprenorphine and naltrexone are used to ease withdrawal symptoms and reduce cravings. Others may benefit from cognitive behavioral therapy, which helps individuals to understand their addiction, manage stress, and develop healthier coping mechanisms. Then there's residential treatment, an intensive form of care where individuals live within a treatment facility for a period of time. Here, they receive round-the-clock medical care and therapeutic support, offering an environment conducive to recovery. Outpatient treatment, on the other hand, allows individuals to continue living at home while receiving regular treatment at a clinic or hospital. However, it's not just about the treatment method itself. Personalized care plays a crucial role in successful recovery. It's about understanding the individual, their needs, their triggers, and their strengths, and then tailoring a treatment plan that best suits them. It's about empowering them to take control of their lives once again. But let's not forget the power of support systems in this journey. Recovery is not a solitary endeavor. It's about leaning on others, finding strength in shared experiences, and drawing hope from the success stories of those who've walked this path before. Support groups, family, friends, therapists, they all form a network of care that can make the journey less daunting and more achievable. Recovery is not a one-size-fits-all journey, but with the right support it is possible. It's a testament to the resilience of the human spirit, a reminder that even in the face of adversity, there is always a beacon of hope. So, where do we go from here? How can we navigate the future of opioid use? As we look towards the horizon, it is clear that change is necessary. The future of opioid use must be shaped by continuous innovation, policy shifts, and a commitment to better understanding this complex issue. New strategies are emerging, ones that aim to prevent addiction before it takes hold. These include educational initiatives, improved prescription practices, and a stronger focus on non-addictive pain management alternatives. Policy changes are also on the cards. Legislators are recognizing the need for more stringent regulations around opioid prescriptions and a shift towards policies that prioritize patient safety and well-being. Innovation is key. From new therapeutic approaches to technological solutions, the field continues to evolve in the face of this crisis. By understanding and addressing opioid addiction, we can chart a new course towards a future free from the shadow of this crisis. Together, we can navigate towards a safer, healthier future for all. That's it for our journey through the world of opioids. We've seen the double-edged sword of hope and addiction, the broken promise when medicine becomes menace, and the unexpected journey into addiction. We've delved into the science of addiction, risk factors, prevention, and the hope in treatment and recovery. We charted a new course looking at emerging strategies, policy changes, and innovations that aim to prevent and treat opioid addiction. But this is just the beginning. The fight against the opioid crisis is far from over, and it's a fight we all have a role in. If you found this video informative, please like, subscribe, and share it with your friends, family, and loved ones. Let's spread awareness and knowledge. Remember, every single share could potentially save a life. Together we can spread awareness and help combat the opioid crisis. Thank you for watching, and remember, knowledge is power. Use it to make a difference.